looking at the heart, the easy way to tell if you're looking at the front or the back is look at the apex, this little tip at the bottom. If it's pointing to the anatomical left, then it's the front. If you flip it over, you see that the apex now points to the right. So it's easier to keep track of it that way. Plus the back just sort of looks messy and ugly up here, and the front looks kind of like what you would expect the front.
Is this the heart you're going to use for the test?
Probably. I do like this one a lot. But there's some other good ones in that bucket too, so it could be any of them.
But they'll be like all cow hearts, right?
Mostly. I'll show you as we go through which one's cow, which one's cat, and which one's model.
Okay.
Okay, so the next word on here is the base. The base refers to any of this stuff. It's sort of like what everything attaches to. And there's really no way I can ask that on the test, but it's good to know what it is so you can scratch it out. Alright. The auricles. The auricles are these little floppy doggy ear things right here. There's the left auricle and the right auricle. And you can see them on the model. They're sort of like those floppy things. And you saw them in your cat. So on the atriums, you could easily see those little auricles. They're attached to the atriums. The ventricles. Alright, so open it up. You have the left atrium, left ventricle. Makes a nice convenient V shape for ventricle. The atriums have this nice big open space. Then we have the right ventricle, is much smaller looking, and the right atrium. Alright, the easy way to tell which way you're looking at it, the apex is pointing to the left still, but I could be showing it to you that way. Now it's hard to tell which one's left and right. The trick to this is, no matter which way you're looking at it, the wall of the left ventricle is always going to be much bigger because it has to pump that blood all the way from your heart down to your toes. So it has a lot more it needs to do. The right, we're only going to the lungs, and you saw how close the lungs were to the heart, just bloop, and back. So that's got a much thinner wall. No matter which direction you're looking at it, that left side is always going to have a much thicker wall. Alright, so what's the next thing on the list? Ventricles, superior vena cava. So this one's really tough to see on the cow heart, but it's totally capable of being shown. So this one, it feeds into that right atrium. That is the superior vena cava. Now the inferior vena cava is right here, it goes in that way, but this one's easier to see. I'll show you, it pops out right into that atrium. So that is the superior vena cava. I prefer to ask that question in a much less confusing way on the model. So there's the superior vena cava and the inferior vena cava. And we also see it very easily on the cat. Those were already ones you covered. Okay, pulmonary veins. So these are the little pulmonary arteries and veins that head into that left atrium. So for those, we're going to look for little tiny arteries and veins that enter into the left atrium, and sometimes they're hard to get to, but there's one. Again, kind of tough to ask on this. So I like to ask them on the model. So here are the pulmonary veins. This is the only time we see red veins. And there's the pulmonary arteries. So pulmonary veins, pulmonary artery. This one right here, it's hard to tell whether we're looking at a vein or an artery, but this one's definitely a vein. Because, yeah. Okay. The pulmonary trunk branches into the pulmonary arteries. Pulmonary trunk, right there. Aorta, this big guy right here. Aorta is going to come up, do a U-turn, and drop behind the heart. You can also kind of track them by sticking a probe in and seeing where they come out. This one's going to come out into that ventricle, there it is. You can kind of see it comes out through the ventricle, to the right ventricle. The aorta, that one's much easier to see. I'm going to stick this through this is the brachiocephalic trunk of the aorta. So that's that brachiocephalic trunk. It's the first branch off the aorta, and it's huge. So if you stick it through there, open it up, you can see it's going right into that left ventricle. So aorta, right from the left ventricle. Let's see. So there's that brachiocephalic artery. Coronary arteries. Coronary arteries, any of these little arteries running on the front of the heart. You can see them much better on the cat, and you can see them on the model as just the red arteries and veins that run on the front. Nothing fancy to those. Myocardium, back to open. Myocardium is just this big muscle right here, and it's actually all of this muscle, but I like to pin it here. And I'll just tell you that now, because this is the only thing that's the only thing it can be. This can be something else, and this is really too thin. So that's the best one for myocardium. Endocardium is on the inside, endo inside. So it's all this smooth stuff right here. So any of this stuff, I would pin it and say, what muscle is this? So there's the endocardium. If I pin it on the outside, I'm asking for the epi outside cardium. So I'd basically be pinned there, and I'd have a little note next to it, what muscle is this? So for all three of those. Right between the two ventricles is the interventricular septum. So right here is the interventricular septum. It divides the ventricles. Now we're going to get to the sulcuses. Sulcus is a groove, if you remember from way back when the brain. The anterior interventricular sulcus is a groove you find right between the ventricles on the front of the heart. So anterior interventricular sulcus. Posterior interventricular sulcus. It's going to be on the back side. The tricuspid. Oh, did I miss one? I did. I missed the atrioventricular sulcus. That's just the little sulcus divides the atrium from the ventricles. It would be like that on the test. Now my favorite part. So it's right to tri. So that's the tricuspid. It's going to divide the right atrium from the right ventricle. So that little valve that divides the atrium from the ventricle on the right side. The left side has the bicuspid, so that little valve right there, dividing the left atrium from the left ventricle. The pulmonary semilunar valve, basically impossible to see in this heart. It's way up in here. So I always ask this one on the model. It's that little valve right there that looks like a butt. Because it's semilunar, kind of looks like a butt. Alright, so there's your pulmonary semilunar valve. It's right next to the pulmonary trunk. The aortic semilunar valve, impossible to see in the model. Not impossible, but hard. It's up in there, way up in there. And it goes right into the aorta. However, in the heart, for the cow, it's really easy to see. So this was the aorta, coming out of the left ventricle to the aorta. There is the aortic semilunar valve, that valve right there. Note that it has no strings on it, but these did. The strings, chorda tendini. Its a little translation is heartstring. But that's everything.
So